Today we're going to review our new patient summary based on the recent American Academy of Pediatrics clinical practice guidelines for opioid prescribing for acute pain management in children and adolescents in the outpatient setting. Now, the objective of this guideline and this patient summary is to aid patients and their families in understanding when opioids may be indicated to treat acute pain in children and adolescents, and how to minimize the risks associated with the use of opioids, including opioid use disorder, poisoning, and overdose. Now, throughout this patient summary, we'll refer to opioids, which includes medications such as, but not limited to, codeine, fentanyl, hydrocodone, hydromorphone, methadone, morphine, oxycodone, oxymorphone, tramadol, and others. And as a reminder, this patient summary is specifically for children and adolescents in the outpatient setting, which means it's not for those who are currently in the hospital, and is only for the use of opioids in the management of acute pain. So what is acute versus chronic pain? Here's a quick overview. So acute pain is a short-lived pain that usually goes away once the underlying cause has been treated. Examples of conditions that can cause acute pain include things like a broken bone, a burn or a cut, dental work, or pain after a surgery. Now, chronic pain is pain that is ongoing and can sometimes last for months or years. Examples of conditions that can cause chronic pain include things like arthritis, fibromyalgia, certain types of cancers, and the medications used to treat them. Now, when treating acute pain, any use of opioids should be only done as part of a multimodal approach, which means including it as a part of a treatment plan that has one or more of the following: a non-pharmacological treatment, and these are treatments that do not involve any type of medications or drugs. So these are things like physical therapy, ice and heat treatments, mind-body practices like yoga, tai chi, and massage. And then there's also non-opioid treatments. So these are treatments that involve a medicine that isn't an opioid. So these include things like topical or oral NSAIDs and acetaminophen. There's also acute pain management through lifestyle changes. So these are things that can be done in daily life to help manage some of that acute pain. This includes things like changing our diet, stress relief and relaxation techniques, and exercise. Now, opioids come in many different strengths and formulations, with the most common one being administered or prescribed being by mouth or orally, either as a tablet, a capsule, or a liquid. And these can be further categorized based on whether or not they are extended or immediate release. Now, extended release medicines are generally only taken once or twice a day because they're specifically designed to provide a pre-designated amount of medication that gives you it throughout the day. Now, as the name suggests, though, the benefit of an immediate release medication is that they work quickly to start relieving the pain. The disadvantage is that the relief doesn't last for many hours, though, so as a result, you might need to take it more frequently. Now, the decision to start and use opioids and the specific opioid that might be prescribed often depends on one or more of the following conditions: how old the person is or their patient's age, whether or not that pain is chronic, acute, or both, the presence of any other pre-existing conditions like sleep apnea or severe lung disease, if there is any other medications being taken, especially a sedating medicine like a benzodiazepine, amongst others. So with that, let's jump right in and explore the key recommendations and takeaways from this guideline. Opioids should not be prescribed by themselves when treating acute pain. Acute pain should be treated using a mix of non-pharmacological therapies or non-medication-based treatments, non-opioid medication treatments, and, when needed, opioid medications. When prescribing opioids for acute pain in children and adolescents, immediate release opioid formulations should be used. These should start with the lowest age and weight appropriate doses, and patients should be provided with an initial supply of 5 days or fewer unless their pain is related to a trauma or a surgery with an unexpected duration of pain that's lasting longer than 5 days. Codeine and tramadol should not be used to treat acute pain in any of the following situations: for children younger than age 12, for adolescents 12 to 18 years of age who also have obesity, obstructive sleep apnea, or severe lung disease, patients with post-surgical pain after a tonsillectomy or an adenoidectomy for children and adolescents under age of 18 years, and for any patients who are breastfeeding. Opioids should be used very cautiously in children and adolescents who are also taking any type of sedating medicines like a benzodiazepine. If you're unsure, make sure to talk to your healthcare provider about whether or not you're taking any sedating medications. It's always better to be safe than sorry. Parents and caregivers of children and adolescents taking opioids should be taught how to spot and respond to an opioid overdose, should be prescribed naloxone and taught how to use it at the time they're prescribed their opioids. They should also be counseled on the safe storage and administration of opioid medications, and educated on the safe disposal of unused opioid medicines. Opioids may be used to treat acute and worsening pain in children and adolescents with pre-existing chronic pain. It's important to work with a care team represented by experts spanning multiple medical specialty areas to determine the best long-term treatment plan for conditions causing chronic pain. Now, naloxone is a medication used to treat an opioid overdose, and it works only for overdoses from opioids. It's available as a nasal spray and in an injectable form. But having naloxone available can help save a person who has taken so much opioids that they stop or are having trouble breathing. Now, if an overdose is suspected, call 911 immediately and give naloxone as soon as possible. Now, keep in mind, more than one dose of naloxone may be needed to reverse an overdose if it's a high-potency opioid, such as fentanyl. Now, naloxone may need to be given multiple times since its effects wear off faster than an opioid often does. So to ensure that the patient's staying safe, the patient themselves, their family members, significant others, and their friends should have naloxone on hand and should be trained in its use in case of an overdose. Now, for all patients taking opioids, their healthcare provider should provide naloxone or a prescription for naloxone for both the patient and their family members. Naloxone is available without a prescription through the pharmacy. Now, when talking about opioid overdose, the first thing that you need to know is that an opioid overdose needs immediate medical attention. It is a life-threatening risk, and it is something that you want to make sure you're paying attention to. So let's talk about some of the do's and don'ts of an opioid overdose. For the do's, if the person is suspected or having an opioid overdose, do call for help. Dial 911 immediately. And do support their breathing, either by administering oxygen or giving rescue breaths. And do administer naloxone. This is the medicine that reverses the effects of opioids. It can be given as an injection or as a nasal spray. All friends and family members of patients being prescribed opioids should have naloxone and know how to use it. If the person is breathing independently, put them on their side. And do stay with the person during the overdose and make sure to keep them warm. Now, for the don'ts. Do not slap or forcefully stimulate a person who's overdosed. It will only risk causing further injury. If shouting or rubbing your knuckles on their sternum, which is the center of their rib cage, or light pinching them won't wake them up, he or she may be unconscious. Do not put that person into a cold bath or shower. This also increases the risk of falling, drowning, or going into shock. And do not inject the person with any type of substance, including milk, speed, heroin. The only safe and appropriate treatment for an opioid overdose is naloxone. And importantly, do not make the person vomit any drugs that he or she may have swallowed. Choking and inhaling vomit into the lungs can cause a potentially life-threatening complication. So there you have it, a summary for patients recapping the new AAP guidelines for opioid prescribing for acute pain management in children and adolescents in the outpatient setting. Now, for more information on this guideline or to access the patient summary or any of our other patient summary resources, visit us online at guidelinecentral.com or download the Guideline Central mobile app, available on iOS and Android devices. This has been Guideline Central Productions, and we'll see you guys very soon on our next summary.